Hello and welcome to Tuesday Talks, brought to you by General Practice Solutions. Today we're discussing how primary care organizations can optimize workforce planning, one of the key services that GPS offers to support general practices, PCNs, and ICSs. We'll be exploring what good workforce planning looks like, the risks of poor planning, how GPS can help, and the practical steps practices can take to strengthen their teams and future-proof their operations. In the current primary care environment, practices face high demand, workforce shortages, and increasing complexity. Having a robust workforce plan is therefore essential. Without one, there's a real risk of over-reliance on ad hoc locum cover, high staff turnover, poor continuity of care, and ultimately a compromised service to patients. Effective workforce planning means projecting future demand, mapping existing clinical and non-clinical roles, identifying skills gaps, and creating a staffing model that is both sustainable and aligned with the practice's strategy. At General Practice Solutions, we provide a dedicated workforce planning service specifically designed for primary care. This begins with a baseline audit of your current staffing structure, capacity, and service delivery model. We then create future state workforce models and use scenario planning to explore how different staffing configurations might work. For instance, what happens if a new service line is introduced or a partner retires? Once the optimal structure is identified, we support practices in implementing their plan, including recruitment strategies, role redesign, training frameworks, and performance monitoring. By partnering with GPS, practices gain access to specialist expertise, evidence-based templates, and tools developed specifically for the NHS primary care setting. Our team understands the realities of practice operations, from the pressures of the GP contract to the dynamics of PCN workforce funding, and ensures that every plan is both practical and achievable. We recently supported a large group practice of around 25,000 patients who were struggling with high locum expenditure, low staff morale, and difficulty recruiting. Our diagnostic identified that many GPS were spending significant time on work that could be safely and effectively managed by advanced nurse practitioners and pharmacists. We also found that the practice lacked the data tools to predict future workload and capacity. After working with them to redesign their clinical model, introduce a more efficient triage process, and establish a 5-year workforce plan, they reduced their locum costs, improved staff satisfaction, and gained a much clearer strategy for succession planning. Of course, workforce planning is not without challenges. Demand patterns change quickly, funding can fluctuate, and there's constant competition for skilled professionals. Practices also face governance, data, and change management barriers. That's why GPS emphasizes that workforce planning must be treated as a continuous process, one that is reviewed, measured, and adjusted regularly. We help practices build this review cycle into their operational rhythm so that planning becomes part of business as usual rather than a reactive exercise. If you're considering workforce planning for your practice or PCN, the first step is to understand your current position. Collect information about your staffing levels, turnover rates, locum spend, and service demand. Define your vision for the future. What services do you want to provide, and what skills will you need to deliver them? From there, GPS can work with you to develop a detailed, data-driven plan that supports growth, resilience, and long-term sustainability. Thank you for listening to this episode of Tuesday Talks. If you found today's discussion helpful, please share it with your colleagues and practice managers. To learn more about our workforce planning service or any of our other support solutions for primary care, visit our website or contact us directly. We'll be back next Tuesday with another topic focused on strengthening primary care operations. Until then, take care and thank you for joining us.